One of the first myths I wanted to talk about is the very definition of advanced care planning and palliative care, because it still remains for many people, both medical providers and patients, when they hear advanced care planning, palliative care, they immediately think about death, about end-of-life care, hospice care, and this is very, very wrong. Advanced care planning ensures that the future medical care reflects patients' personal goals, values, and preference, and actually everyone should have an advanced directive, regardless if they have an illness or not. The forms are easily accessible. They are free online. They might differ across the state, but most of the time will involve designing a person as a surrogate decision maker, and also making a living will, which will point out the relevant goals of care for that particular person. When it comes to palliative care, this is a subspecialty that aims to improve the quality of life of patients and their caregivers who are facing any advanced chronic or life-limiting illness. It's definitely not limited to cancer alone, although our patients with liver cancer, in a way, they have the advantage that our oncology colleagues are more advanced in offering palliative care, part of their routine care. But now we are trying to catch up and expand this to anybody with advanced liver disease. And truly, palliative care is the subspecialty that includes, pays a lot of attention to symptoms management, the provision of advanced care planning, and trying to bring everybody together to reflect and discuss on future care, and very importantly, caregiver support. Yes, hospice care is part of palliative care, but it's offered for patients with estimated survival less than 6 months. So definitely, palliative care is not limited to hospice care alone. It's interesting because one might say, what's in a name? But names are very powerful. Words are powerful. We are involved in a palliative care study offering palliative care to our patients with advanced liver disease. And when we initially approached our patients for this study, many were turned off just when they heard palliative care. So we have a lot of work to do to clarify this concept and the importance of using palliative care in our management of liver disease. Why are advanced care planning and palliative care important? This is definitely not just to point that somebody's wishes are do not resuscitate. It's much more than that. Advanced care planning ultimately will lead to writing an advanced directive, which it showed that it helps not only the patients think through what they want to happen to them in the future, but it actually helps a lot the surrogate decision makers and the family members who, instead of struggling with taking this type of decisions in a very stressful setting in ICU when things are really, really bad, they have a sort of a plan that was discussed in advance and everybody is on the same page. So I just wanted to point out that it's very important, not just for patients, but also for their family members. As far as palliative care is concerned, many still think that this means giving up and stopping any other care. Again, as I said, many still associate palliative care with death and end of life. And this is, again, very, very wrong. Palliative care benefits are shown to affect people, especially earlier in their disease course, because it can actually improve quality of life, increase patient and their caregiver satisfaction, reduce symptom burden. So reserving palliative care only at the end of life really deprives patients and families of many benefits. So when to do advanced care planning? And again, this is another very misunderstood concept, because many still think this is for the terminal stage. Advanced care planning is an ongoing process throughout the illness, the course of illness trajectory, and also very important, it's a living process. It can change as the care preferences will change as the disease progresses. Unfortunately, patients with liver cancer face not only the problems related to their liver cancer, but also related to their failing liver, because cirrhosis, although in many patients with liver cancer can remain relatively stable, in some patients by itself can get worse. So even if the cancer is small or is treated, the cirrhosis can progress to what we call decompensated cirrhosis, with associated problems related to organ failure and associated decrease in survival. So as you can see on the first picture, this is kind of what happens to somebody with advanced age. They become frail, they might have ups and downs, and ultimately all of us die eventually. Patients with advanced cancer have, and as long as it doesn't cause organ failure, can have a sort of linear trajectory. As the cancer advances, the patient's function declines, and ultimately they die. But organ failure is very different, because patients can have good times followed by bad times with hospitalizations. Then there is some recovery. A lot of times it's not back to where they started, followed by, again, worsening and ultimately death. And it's very difficult to predict what's going to happen. And like anything in life, it's better to be prepared for the worst and hope for the best. But this is a concept that many patients and their providers still struggle with. So my point is that advanced care planning is never too early to start advanced care planning, and definitely shouldn't wait until the very end. Another very common misconception is that palliative care means stopping life-prolonging treatments or curative treatments, and it's sort of black and white. You either do treatments such as transplant or surgery or everything that you heard on prior talks, or all of those stuff, and you start palliative care. So this is very wrong, because patients who are earlier in their disease stage and still benefit from curative treatments, they have other symptoms or problems affecting their quality of life that are not addressed by usual liver treatments. And if we don't practice care, keeping in mind palliative care principles, those patients do not get the full benefit that we can offer. So most of the time, it's sort of an interbalance between what can be done for the liver cancer or for cirrhosis treatment, but keeping in mind palliative care in controlling symptoms, supporting the patients and their families, while they have to cope with these very complex decisions and treatment choices they have to make. As the disease progresses, when it gets to the point that curative treatment are no longer an option, that's where indeed palliative care takes a first place, and at the end, hospice care is in place to ensure the comfort of the patients and their caregivers. But as you heard before, and that's why it's important to have a multidisciplinary approach to treating liver cancer, it's very important to offer the right treatment to the right patient, because offering something super invasive can actually cause somebody to die sooner than if otherwise the care would have been focused on symptom control and quality of care. What about timing of advanced care planning and palliative care and the setting of advanced care planning and palliative care? These discussions, as I said, is better to start early in the disease course and ideally to be in a more relaxed setting, regular clinic visits. And it's important to start early because it's also essential to have the patient stable and well enough to participate. And I cannot emphasize enough how it's also very important to involve the caregivers and the surrogate decision makers, because this type of discussion shouldn't happen in the vacuum. So even if the patient, it's very clear between the patient and their providers what they want to do, if the surrogate decision maker is not involved in these discussions, it's going to be very difficult for them to make this type of decisions when the time comes and the patient can no longer have a say in what is going on. Also very important because, as I mentioned, the course of disease can fluctuate over time. It's important to reevaluate this type of decisions or wishes after sentinel events such as hospitalizations, especially if intensive care unit treatment was needed, or development of complications, or before making a decision to proceed with life-supporting therapies or surgeries or so forth. And again, very important is to know that palliative care is not limited to hospital setting alone, and it should be integrated throughout all the phases of care, be it inpatient, outpatient, in the transplant clinics, before, after transplant, long-term care facilities, at home. Palliative care should follow where the patient is. Who can do advanced care planning and palliative care? Again, this is another misconception that for advanced directive, you need a notary public or an attorney. As I said, the forms are free online. You do not need anything extra unless you wish to add to the advanced directive a witness's affidavit, which it is recommended because if there are any discussions later on, the witnesses, they don't have to appear in front of a judge or get involved in legal proceedings. So this would give more strength to the advanced directive. But if one doesn't wishes to do so, again, it's very easy to fill out these forms together with the medical providers, so the patient understands the various choices they can have as far as their goals of care, but also to make sure that their surrogate decision maker knows what are their wishes for the future care. Last but not least, I also want to point out that palliative care and advanced care planning should be done by providers from any specialty. Of course, with the help, if needed, from specialist palliative care providers, but the need for palliative care is so high, and we simply do not have enough workforce to cover, to have palliative care provided by specialists alone. And as you saw on prior presentations, this is a team effort, and it's very important to communicate and very clearly with all the members in the team, keeping the patient and caregivers in center, and make sure their needs and their wishes are heard and addressed. And just wanted to end by quoting Winston Churchill, who said that we should turn our advanced worrying into advanced planning, So I don't think he had liver cancer in mind when he said that, but I think it applies very well to proper management of liver cancer as well.